Hello.
Are we live?
It's Friday. Woo! Cheers. Happy Friday, everyone.
If Dr. Sukar, if you're watching, this is just orange juice.
Just orange juice, just a little OJ. Vitamin C. We need vitamin C, right?
Okay, so let's wait a little bit for people to log on.
Yeah.
Who's here?
So as you guys are hopping on, if you'll say hello.
Hey, Heather.
Woohoo! Hello, Heather. Welcome. If you can hear us, if you will give us some thumbs ups or some hearts, we'd appreciate it. And if you can see us, if you'll do a hashtag Cellulite.
Now I'm just like, this is really cool lighting, Jess.
Yeah, you like it?
This is the lighting I need for when I do videos with Dr. Sukar.
Yeah. All right, Heather, so you can hear us and you can see us. Awesome. If you'll do us a favor, if you're watching this on the replay, go ahead and do hashtag replay for me. And we're going to be doing some really fun things on this video today. So I need you to like this video.
Share it.
Yes, definitely share it.
And ask questions.
Yes.
Because everyone that asks questions and everyone that shares is going to be entered to get a free Cellfina treatment.
What?
Yeah.
Oh my gosh. I wonder if I can do it.
Yeah.
Okay.
No.
Oh,
Wait, what? Okay, so as we're waiting for more people to come on, Jess, tell us about your personal life.
Well, you know. No, I'll go ahead and introduce myself. So those of you that actually don't know me, my name is Jessica, and I've been with our practice, the Clinic for Plastic Surgery, for nearly 7 years now, and I am a patient coordinator, spa manager.
Oh, yes, we haven't announced it yet officially, but congratulations to Jessica!
Yay!
She just became our spa manager.
I'm so excited, you guys.
So you'll be seeing a lot more of these two faces, especially
Yeah.
for the spa procedures.
Yes, exactly. So now who are you?
I am Elizabeth Taylor. No, I'm Ashley. I do the marketing here and the videos now.
Yes.
So I don't even remember how long I've been here. Like 4 years.
Almost 4.
Okay.
Yep.
Jessica remembers everything. She remembers each and every one of you too. So today we're going to talk about Cellfina. Now,
Yes.
what is Cellfina?
Well, that's one of the questions that we're going to actually answer for you.
In marketing, it's really frustrating that Cellfina hasn't been more like on the news, on TV and stuff. But did you know that today they got their 5-year?
I was reading that.
Yeah.
I'm super excited. We've been waiting for this data to be published. So
Because it's so new, this now has a 100% satisfaction 5-year
data. Yeah,
collection,
so
whatever.
the 5-year data, the results have been published. Actually, they were announced this week at a medical conference, and the outcome is 100% patient satisfaction. So,
Vinny said congrats.
oh, hey, thank you, Vinny.
I accidentally called someone else by your name today, and it was not okay. So I've been thinking about you.
Yeah, you're on our minds, sister. So, some things we're going to cover today is what is Cellfina, okay? Does it work?
Sorry, I'm like squinting.
Does it hurt? How long does it last? And how much does it cost? Because everybody wants to know, right? That's bottom line, right? But we got to get through all that other stuff so we can go through costs. Okay?
Oh, and today we'll be giving all of our viewers a special discount.
Yeah, so you need to stay tuned to know what that special discount is, okay? Or if you're watching on the replay, you've got to watch it all the way through because we get to announce some really exciting things. So, what is Cellfina?
Okay.
Besides amazing, right?
Okay, so what we're talking about now, the problem, cellulite. And so our rep, Mark, he's the best. Shout out to Mark if you're watching. He told us that there are, I think the number is 85% of women have cellulite somewhere on their body. And we like to say that the other 15% are lying.
Exactly.
Because everyone has cellulite. It's just a thing. Like, it's genetics. It's growing up. I'm feeling that.
Well, and it doesn't matter, you know, your size. I mean, we have patients come in and get Cellfina that are 92 pounds. And we have patients that get it that, you know, 160, 170, 180, whatever.
And honestly, diet and exercise, it's not going to fix these dimples that you have. So just tell us quickly like the scientific definition, because I don't like to get all.
So basically, cellulite, if it's true cellulite, you're seeing these dimples, kind of this little valley in the skin and the tissue, primarily on the back of the thighs and the buttocks. So what that is there's a little band underneath that tissue. So think of it as like, you know how kids play tug of war and they're pulling on this band back and forth? Well, think of, let's say, you know, this is your skin and there's this band here. Well, that band is pulling down, so it's creating that valley. So in order to...
You can use my dimple as an example.
Oh, see, did you see this little dimple?
I've already tried. They won't take these away.
I wish I could have them, actually. So cellulite actually tends to look kind of like a little dimple, right? It's this little divot in the tissue. So there's a little band behind that, a little fibrous band that's pulling that tissue back as you animate or move, or even if you're standing still, standing up, or laying down. So we need to release that band in order to correct cellulite, right? So
there's no other way to do it.
You have to do a full release.
Have you seen all of those crazy things on Facebook,
Oh my God.
Instagram that say they're like?
I've seen the, like, what is it, the fascia blaster, that
Yes.
little, like, thing,
Girl,
like...
yesterday I saw a loofah. It looked literally like a loofah that you're supposed to just, like, spread all over the area. I don't understand how
Scrub
the loofah is going to get all the way down there.
exfoliation,
But
right?
anyway, so there's lots of crazy things that people are saying will work for cellulite.
Yeah.
But this is the only FDA-cleared, effective solution to long-lasting cellulite removal. And the only reason it's long-lasting and not everlasting is because it's so new that we don't have the data yet.
Yeah, the only data that we've got is, like we mentioned a while ago, how we're super excited. The 5-year data was just published this week at a medical conference. And so that is tremendous because we had the 3-year data that we were able to present to patients that has been published. And, I mean, it's tried and true. There's no ifs, ands, or buts.
Yeah.
But
and if also it comes with a retreatment guarantee. So they're so confident that these bands are not going to reform, that they're going to retreat it if you're not satisfied with the results that you get.
Which is awesome.
Which is results they speak for themselves.
Yeah.
We'll show you some pictures in a bit.
Yeah, we're going to show you some of our patients on the TV behind us. So, okay. So we talked about what is it. Okay, so we're addressing cellulite, and does it work? Yes. Okay.
Yeah, definitely works. We'll show those pictures in a sec. So a lot of people have heard, now, because of great marketing, there's another product that is very well known, and Dr. Sukar actually bought one of these machines, and we still get requests for this cellulite treatment. I'm pretty sure it's collecting cobwebs in the back.
Probably the most expensive
OR.
coat rack Dr. Sukar's ever purchased.
Yeah. But just because Dr. Sukar doesn't want to use anything that isn't effective. And he has tried it several times on us, not on me, but on staff, and it doesn't produce the results that even come close to what
Cellfina does. So basically what we're talking about is comparing a procedure that came out a handful of years ago before Cellfina. It's called Cellulase, and Dr. Sukar is actually one of the very first board-certified plastic surgeons in the state of Texas to get it, which was great. We were super excited about it
because it promised the fight was over, the cellulite fight was over, and we were able to tighten the skin, smooth everything out, do a little lipo, and your dimples would be gone.
Yeah, so what came about of Cellulase is that what we were seeing is patients were only getting about a 30 to 50% improvement, and the reason that was because with Cellulase, it's using a laser to try to lyse and release those bands, and what's happening...
Is lyse a word?
Yeah, it is.
Okay.
Yeah. Yeah, it is. We're going to go with it, okay? So it uses a laser, radio frequency, to try to cut those bands, and what was happening is that it wasn't cutting it completely through, and it's leaving some slivers of those bands upward to the tissue. So then over time, it's kind of like, you know, when you grow vines on a lattice or something like that, they regrow up. So what was happening is those slivers that were still connected were then re-strengthening, and so then when we got the cellulite again. And those fat cells weren't able to redistribute because pieces of that band were there.
So it ended up looking really spotty, really like lumpy, and didn't last very long.
Yeah, so we weren't getting those full releases to allow things to smooth out. And so Cellfina, actually, because it does that full release, it lets go of that band. Well, now that wall that was there and there was fat cells on each side of those, you know, in those chambers, now they're able to move in and redistribute and close in and fill in that where that wall, where that band was. So that's why it is so incredibly effective because it is doing that full release. So
awesome.
Exciting.
So there's the sciencey part of it. Let's show you some results so you can see for yourself.
So we'll move out of the way. We'll move our orange juice out of the way.
Okay, so this is a great example. We are actually not going to touch you because we have someone way better that's going to do this for you. We have our own trained and gorgeous Ruby that performs all of these. These are our actual results, not from Cellfina. This is what Ruby, this is Ruby's. We should like print this out and put it on the fridge because this is Ruby's work. So if you see, can we see that? Yeah, okay. You definitely can see these deep dimples right here. And here's the after picture. They're gone. And they're gonna be gone forever.
Yep. So incredible. So the next patient that we're gonna show you, you can see that she's got some pretty prominent dimples.
This is a cute butt.
I know. Some pretty prominent dimples on the buttocks here. Just, you know, it's just not allowing me to really appreciate smoothness to the buttocks. And so Ruby was able to do full releases of those. Okay?
Word to our patients, so let's keep the tans constant. I know I'm my before and after
but with
I had
spray
a
tan,
tan.
not a tan.
It was a spray tan.
Tanning is horrible for you, right?
No, but she looks great. And now she's ready to wear her Daisy Dukes. I have one more picture here. This shows the process. So here was before. You see those dimples there. They're very prominent. You can tell they're there. Here is where Ruby marked her.
She marked out all the little pesky dimples.
And then here is the after result. Smooth.
And something too, you guys, obviously you're on Facebook, but I want you guys to, if you have an Instagram, I want you to go to our Instagram because we have these pictures posted on there and we have more on our gallery on our website, which is drsukar.com. But if you go to our Instagram, we have a non-surgical one and it's bod_sculpting. And you'll see it pop up with Clinic for Plastic Surgery underneath it. But if you could go ahead and follow us on Instagram, you can actually see these photos and you can zoom in up close and right up in there so you can see for yourself how amazing this transition is. Now, a lot of patients want to know when I have this done, what do I expect? So what's going to happen after I have this, right? So because we're doing a full release... Uh-oh, who's on there? Lori, hey! As you guys are coming on, say hello, drop us some likes, hearts, comment, ask questions, because that's going to enter you in a drawing to win a free treatment. So we're super excited. Okay, so what happens when you have Cellfina done, right? Okay, so everyone wants to know, okay, does it hurt? Does it hurt? No.
I haven't had it yet, but the worst part is just the numbing. And that's what's going to actually help you through the entire process. So, you know, bee stings, if you are a fan of Botox, like we both are, that's all you're going to feel. You're going to feel that for a second or two, and then Ruby gets to work. We've had several patients that have just fallen asleep.
Yeah, they just nap through it all.
It's going to take, your procedure is going to take anywhere from 45 minutes to 2 hours. 2 hours and Ruby was able to get done 60 releases or more.
Yeah, I think we did a 66 release case not that long ago.
And releases are when we release those bands from the dimples. So essentially it's by dimples, however many dimples you have. Who's over here? Hey, Sarah and Suzanne.
Hello. Yay. You guys make sure you comment below and ask us some questions so we can get them answered.
And get you a free treatment.
Yes.
We haven't had any yet, so whoever answers asks the question.
Have a higher chance,
Yeah. Okay, so
Ashley just went over how long the treatment takes, because that's a big question. It's like, okay, well, how long will I be there for my procedure, my treatment, right?
And how long afterwards are you going to be in pain or recovering?
Yeah, so that's actually a really great question. So treatment, 45 minutes to 2 hours.
Do I get to be put in the drawing?
No.
Okay.
You're not allowed.
Okay,
Yeah.
that's fine.
So treatment, like she said, 45 minutes to 2 hours, depends on the number of releases, so the number of dimples that we're releasing. Now, afterwards, what to expect,
Hi,
right?
Denise.
So after the treatment, because the area stays numb, for a bit, you are going to have some very mild, very, very mild bruising, right? Because we have to release those bands. So you'll have some mild bruising. And some things that we do after this procedure really help expedite the entire
Exactly.
recovery
So
process.
a lot of people, you have your choices when you pick a plastic surgeon, and you have your choices when you pick a Cellfina provider, but what all of those other choices don't have is Ruby's magic hands.
Yes.
Now, it's awesome that the person that happens to be doing your Cellfina treatment is also our all-star lymphatic massage therapist.
Yeah.
Can we just talk about real quick how she just, it's like, do you like inject them with like happy fluid or something? Because a patient can be like sad and down, whatever, because after surgery,
Tired,
you're going through a lot of
exhausted.
things. As soon as they come out of Ruby's room, it's like, well, we'll see y'all tomorrow.
They're like Miss America.
Yes, exactly. So, Ruby had, just for her patients, for her Cellfina patients, she is giving you 3 free massages.
Mm-hmm. And these aren't like the massages you'll go get.
Yeah,
at like
it's
a
not
frou-frou
fun
spa.
massages. I've
It's
already
a clinical.
tried.
Yeah, I know we were
It's
like,
a
Ruby, could you?
yeah.
It's a clinical massage, and so
It's a lymphatic drainage and just making everything feel better, look better.
Mm-hmm.
Really, Cellfina treatments can bruise you for up to 2 weeks. Ruby, when she works her magic, how long is it?
I mean, we're seeing
5 to 7 days.
Yeah, we're seeing max. Bruising 5 to 7 days, which is phenomenal. So the bruising and swelling you experience after surgery is inflammation and fluid, right? And so the quicker we can get that inflammation down and the fluid out, the less bruising we're going to have, the more comfortable you're going to be, and the faster your body can work on its own to heal. When we've got all that swelling and fluid, your body's having to be in like double or triple time trying to process, absorb, and break down and get rid of that, and then try to heal and make you feel better, right? So the way that Ruby sets this whole thing up to help you recover faster, it really does work, and it's phenomenal. I mean, patients are going back to work like the next day, which is awesome, right?
Which they say you can do that, but really, if you're not getting these massages, if you're not getting some extra attention from Ruby, it's going to be really hard on you, physically, emotionally, that kind of, not emotionally. I mean, I get upset when I am inconvenienced, but
let me see.
Wait,
we got some questions.
One more thing on that.
Yeah.
What's the value of her? Each massage, I think, is valued at $150.
Yeah.
So that's like
$450
just
extra.
added on.
Yeah,
because she wants her Cellfina patients
to recover faster, get going, and just be super excited about already seeing a result. So we've got some questions, so let's go ahead and answer some of those.
Okay, so Lori asked, are treatments on weekends or after hours? Technically no, but because we are offering so many new things now, and we are
we've just exploded
with new stuff, and weekend appointments are going to be in our near future.
Yes.
So not yet. After hours, we can work with you. Ruby will work with you.
We'll figure something
but
out.
weekends are coming.
Yes, they're in the near future. So
thanks, Lori. Love this. Oh, Denise loves us. We love her too.
Yay.
What about restrictions after treatment?
Oh, good question, Lori. Okay. So afterwards, because we talked about there's going to be just a little bit of soreness, and you're going to come back in the next couple of days and have massages with Ruby. We usually tell patients that we would prefer for you to refrain from like doing any lower body working out, exercising, if you can, for the first 5 to 7 days. Just let your body kind of get going and get trucking, so that way that you can feel good when you do get back into the gym.
Yeah.
Okay. So that's kind of the biggest things as far as from a restriction standpoint. You can still shower, you can still do things. You're not restricted, you're not bedridden in that aspect. But the gym, if you could just stay out for the first 5 to 7 days, that would be ideal.
Yeah.
So that way you can let your body kind of.
After all, you are making this investment, so you want to do everything you can to.
Yeah. And getting in the gym and being too active too soon can create a little bit more of that fluid accumulation. So we definitely want to try to put that on pause and let Ruby get that down for you. So,
yeah.
Great question, Lori. So who else we got?
Let's see. Suzanne loves Dr. Sukar.
Oh, who doesn't?
Oh, she worked with him at one of the hospitals that he worked at.
Oh, that's awesome.
I'm gonna have to tell Dr. Sukar that.
That Suzanne said hi.
Okay.
Awesome.
So, what else do we have to cover?
So we talked about the bruising, about the massages. One other thing.
If I look like I'm crazy, I'm reading our notes that we have.
Yeah, just to make sure that we cover everything for you guys, in case you don't ask, because you don't know what you don't know, right? Patricia, I love him too. Aw, see, I'm telling you, who doesn't?
He
He's
thinks
amazing.
that he's so sweet whenever we get like, oh, I love Dr. Sukar, reviews. He takes it personally.
Yeah,
he loves that.
And
he loves
likes
to hear from
you.
y'all.
You see his eyes. He just lights up like a kid in the candy store, like at Christmas, about to open all of his gifts. It's awesome.
So definitely gonna share those with him.
Mm-hmm.
He's actually at LSU this weekend.
Woo-hoo!
Go Tigers!
Go Tigers!
And he just joined one of the executive committees over there. They need his smart insight.
Oh,
So
I love it.
Okay.
Awesome.
Did we get everything? Did we put everything on here?
So if you guys, those of you that are still on right now, if you will drop us a hello or something so we know you're on, and then ask us a question so that way we can answer it, even if you think we already did.
And we'll also enter you into our drawing for a free treatment if you share.
Yes.
Share this.
Like, share, and comment, pretty please.
Okay. Another thing we can mention is compression. Some people ask if they should wear compression garments afterwards. It does help. It's not going to hurt you if you don't, but if you have some Spanx at home,
which most women have a pair of Spanx at home. So if you do, that's really highly encouraged. Just again, from a little bit of a swelling standpoint to help get that down. So definitely highly encouraged, but not a requirement for sure. What else we got? Anybody else have any more questions for us?
I think we just went over it so well.
I know, we were so thorough.
Yeah.
We're just so excited too because it's such an amazing treatment. I mean, it's just there's been all these things out there that
and I'm really confused as to why we've had this for a few months now and people just don't want to talk about cellulite. I don't know why, because like I said, 85% of women have it.
I feel
the
like
other
nearly,
15 are lying.
Yeah, I feel like nearly 100% of women have it, and only 85% actually admit.
That's what you. Yeah. So I was actually, when our rep Mark Mail was telling me this, I was like, I don't know. Do you have any? And he's like, well, I'm a guy, so not really. Doesn't that suck though? Only women get it.
I know. It's like we get cellulite and we have to have babies.
Wait, but my little brother has dimples in his face.
But cellulite on his butt.
Okay, well, I don't know about that.
I think men, their tissues are just so different. It's unfair, It's crazy.
What else? Now we have the solution here at Dr. Sukar's office.
So now you don't have to have cellulites.
Yeah. Okay, so let's wrap this up. I think we are done. If you liked our show, please give us some feedback because we've been talking about maybe doing this more often.
Yes. We're going to have our own series.
Yeah. And we'll have Dr. Sukar on.
Yeah, we're going to have guests.
And our reps. Everyone, let us know who you want on our show.
Yes, or what treatments, procedures, anything you want to know about next. That way we can get some insight and prepare it for you. Make sure it's fun, informative.
And we got this good lighting.
Yeah. It's always good to have good lighting.
Okay. So, thank you everyone for watching. We love you.
Yes.
And we'll see you here at the office for your Cellfina treatment. Oh my god.
Oh, the most important part. Well, it's not really the most important. It's just the funnest part of, if you watched today. Okay, some things that you earn or unlock, which is huge, right? So, just drinking my orange juice. So, those of you that watched our Cellfina Facebook Live, okay, make sure you do comment, like, share. You have to do all those things for us because otherwise
nothing's gonna happen. But so please do that.
Yes.
So the special that we are going to be giving to all of our viewers from now until December 31st.
Yes. What do you get?
20% off.
Yes! Oh my gosh.
20% off your entire treatment of Cellfina.
Yes. So you do have to do those things for us because we love you and you love us, right? Like, share, comment. But you do need to mention that you watched our Facebook Live, so that way that you can qualify to get that 20% discount, because that's huge. That's amazing.
Yeah.
I mean, besides the result, but you get a discount off of it, which is awesome. So it's from now until December 31st. All Cellfina procedures that are completed during that period, you will get the 20% off as long as you mention this live. Okay?
Yeah.
I'm so excited. Great. That is awesome. I have so many friends on my wait list.
I think we only had one person that had questions, so we'll be contacting you.
Yeah, we're going to have to filter through these and
yeah. Oh, wait. So I also have to do... Oh, yeah. Oh, come on.
Who else we got? Christy. All right, Miss Christy, make sure you drop us some comments, questions, like us, comment, share, all the above.
If you have any more questions afterwards, if you're not watching it live, ask some questions. We'll answer them. Dr. Sukar might hop on and answer. He's been on Facebook a lot lately.
Yeah, we're giving him some major props because he is like back in the social media game. You know, we've had him in the OR operating like 90 hours a day.
But now I see him on Facebook and commenting and stuff, and I'm like, Dr. Sukar, we haven't told people that yet, but he can do that.
We'll let him
You want to do another announcement?
Oh gosh.
At the end, I mean, now that we have some followers here.
Uh-oh.
Oh, Chrissy, yes, he is the best.
See? Telling you.
Should we announce? We've kind of soft announced what the other big thing that we're now offering.
Okay.
Let's do it.
Okay.
So, where are we broadcasting from right now?
We are broadcasting live, and you can't see it because it's behind us. Our official IV
hydration station.
What? And you also get injection boosters, but IV therapy, not the most incredible thing, because everything we do here is the most incredible thing.
It's our obsession right now because it's brand new.
So awesome.
Okay, so we'll be doing IV therapy.
Yes.
Myers cocktail, that's the hangover one. That's the one everyone's super excited for. We'll be doing the PMS one.
Yes.
The lipo booster. The athletic energy one. Dr. Sukar and I actually, and Jess. Yeah, we got that one on Tuesday.
Oh my God. I can't tell you, we'll have to do a total Facebook Live, a different one on this, but the way I slept that night, and then like my energy this week has been like way above par.
Yeah, and you can definitely tell the difference.
Yeah, they're like, you guys need to simmer down. We're like, what's the IV?
Hey, so, I mentioned Dr. Sukar that before each meeting, I think it should be protocol that we get an IV.
Yeah, we all get hooked up and just walk around and do our thing here.
I don't think he agreed, but whatever.
Yeah.
So anyway, so there's another little thing to look forward to. We'll be having a launch party, which is going to be so much fun.
Oh my God, it's going to be awesome.
I love planning events.
Yes.
As you know, we're wearing our Sukar University shirts today.
Because you guys are learning at Sukar University today. So
See, Dr. Sukar?
Sukar University. Our little PS logo over here.
I was like, I forgot that was there. Okay.
PS.
Awesome.
Anyway.
So, more to come. That's coming. We're also going to be doing microblading soon.
Yes, so you guys stay tuned. We've got lots of awesome things we're going to be announcing. We already do these things here, but we like to do big announcements so you guys can hear, see, ask questions, and learn. Y'all are so cute, funny. Thank you so much.
I'm the funny one. She's the cute one.
I like to think I'm funny, but my husband doesn't think I'm that funny because I laugh at my own jokes.
No, because you know what? You love dad jokes.
Oh, yeah. We're going to do a series on dad jokes because we love them.
Yeah.
Okay.
Anyway,
back to
now we're being
So I hope you guys have a happy Friday, wonderful weekend. I hope you enjoyed this. Please, again, remember, like, comment, and share so you can be entered to win a free treatment. And now through December 31st, if you have a Cellfina procedure, you get
20% off.
Yes. So.
And always, whenever you have a Cellfina procedure here, you get
the guarantee.
$450 worth of
lymphatic
massages. So.
Yeah. All right, guys, we're going to get out of your hair so you can get back to work. We know you're on your lunch break. We appreciate your time. Thank you again so much. This is Ash. I'm Jess, and we're signing out. So hope you guys have a great weekend. Bye.
Yeah, we should have like a cool thing where
I know.
But we're going to
work on that.
We'll fix it.